to turn to two healthcare workers on the front lines of this pandemic. Jeremy Johnson, he is a traveling ICU nurse for AYA Healthcare, who has been treating patients in multiple COVID hotspots throughout the pandemic. And Dr. Javi Karkowski, she is an obstetrician who has been working with pregnant COVID patients. She's also the author of High Risk Stories of Pregnancy, Birth, and the Unexpected. I really appreciate both of you joining us on this very crucial topic. Thanks so much and good evening to you. Dr. Karkowski, I'm going to start with you. You wrote a very powerful piece in The Atlantic about unvaccinated Americans. This is just part of it. You say, by refusing the most effective intervention, people are risking not only their own life, but the lives of many around them. What makes me the maddest, one of my doctor friends told me, is that these people will reject science right until the second they need everything I have to keep them alive. And then they feel that they can come to our door and be entitled to that help and that hard work. You say to many healthcare workers, rejecting life-saving vaccines feels like a giant FU. That's what you say, from about 29% of adults in this country. Tell me about that.
I think that what we're really seeing is that healthcare is made out of people, right? We're just people. We're devoted people. We're well-trained people. But ultimately, we're people that are going through a really difficult year, now 2 years. And when we feel that most of the country is unable to listen to the science that we have, I think it makes a difficult job, one that is draining and impossible. It's really hard to connect to your team when you feel like they're not quite on your team. And that, I think, creates exhaustion.
Jeremy, you have worked in ICUs in multiple COVID hotspots since the start of the pandemic. New York, Arizona, I believe. Now you're at a Houston hospital. Last year was different, but with life-saving vaccines so accessible, are you having a hard time sympathizing with patients who aren't willing to protect themselves?
Don, first off, I want to thank you for having me on the show. Really appreciate it. As a healthcare professional, you can't have that outlook on it. Anybody that comes into the ICU, is very critically ill, and whether they've got the vaccine or not, it's my job to take care of them the best that I can. With every advancement that we have, and I wish more of them were vaccinated, but I don't treat them any differently. I go into work and I take care of everybody the best that I can.
Yeah. But to Dr. Karkowski's point, though, Jeremy, I think she makes a very good point. That people get to the end of the rope and then they want every bit of science that will help keep them alive or keep them out of pain or to cure them. But the one that they ignored in the beginning is the one that would have helped.
Yeah, absolutely. The evidence is there. The numbers for Delta are spiking. And most of the patients in the ICUs, like a vast majority, they are unvaccinated personnel. And Dr. Karkowski is absolutely right. You get to that point and you get to the point where you want, to repent for that. And you want that redemption for not getting it and taking those steps further. But, at that point, a lot of times, unfortunately, it's too late.
Yeah. You point out that, Dr. Karkowski, that most people are now choosing to get hospitalized with COVID. Are healthcare workers having conversations about how to use limited resources now? I mean, it sounds very harsh, but is there an argument to be had that these people made a decision and now they're facing the consequences?
So I want to reinforce that that's not how we treat people, right? You come to the hospital, we take care of you, the patient, not your bad decisions, or even your decisions. That's not relevant. And I don't think it will become relevant. I think we've all worked very hard over the last year to provide a really high quality of care. What I am saying is that I think providers are getting burnt out. And so what you're having is either providers who are working burnt out and finding that they're unable to muster the compassion they need to do this complex and exhausting work, or they're leaving medicine. And I don't think either of those things are good for the country or for the people.
Yeah, very good point. What are you hearing are points there? What are you hearing from unvaccinated COVID patients in your ICU? Do they regret not getting their shot?
Yeah, because once you get to the ICU, like I said before, Don, the ICU, those patients are the sickest of the sick. Those are the most critical patients. And a lot of times with COVID, they are kind of knocking on death's door. So absolutely, they do have some regret for not taking those steps, to potentially prevent that. Even, I know there's a lot of stuff back and forth about it. But if there's an option to get it, why not? Why not attempt to get that and stop it before it happens?
Dr. Kurkowski, let's talk about the young folks among us who really, can't make the decision for themselves. Some of them can't even be vaccinated. You're a mom of children who are too young to be vaccinated. In the height of the pandemic, you couldn't kiss them for 3 months. Are you worried that you may need to stay away from them again? Can you imagine?
This pandemic was a really big test for us all. And I think, I, like many others, considered moving into my mom's basement and not going to work. And I didn't do that. I went to work and I'll do it again. I'll do it for as long as we need us to. But it has a toll, right? It has a toll on me and my family. There was about 6 months of terror where I really worried what would happen if both my husband and myself got sick and left my children without a caregiver. We can do that and we will do that, but we are, I would say, as an institution, getting tired and probably a little traumatized. I've heard from multiple people who've told me they're leaving medicine after 25 or 30 years of ICU work. That's a loss to us all, and I think we really need to grapple with sort of the hopelessness that's set in the medical profession after such a big ask for so many months.
Yeah, the people who are really on the front lines and who are threatened by COVID at every single moment. You're an obstetrician, Dr. Kurkowski. So I have to get your reaction. The CDC urging all pregnant women today to get the vaccine as soon as possible. They're warning of the possibility of severe outcomes, and I quote that, severe outcomes for those who don't. Talk to me about that. How important is this message?
I'm so thrilled that they were able to use that language. I think that those of us on the front lines have been using the sort of more gentle language that they published a while ago, where they said that it should be available. But frankly, I'm a high risk OB doctor. I have sent many pregnant patients to ICU, intubated, ECMO, delivered preterm babies. And I think what we really need to remember is that not getting a vaccine has risks too. And as we learn more about the risks of not getting the vaccine and learn more about how safe the vaccine has become, I think this new language is absolutely warranted. I'm so thrilled to be able to give such a clear message to my patients.
Thank you, doctor. Thank you, Jeremy. I appreciate it. Be safe.
Yeah, absolutely. Thanks for the opportunity.
Yes.